what delivery method for estrogen, progesterone, and testosterone would you suggest is best to start out on for the first time after a full and complete hysterectomy?
Right. Well, I mean, there's a lot of options and they all work. And it really depends on if you are going, the commercial route or the compounded route. But of course, I'm very partial to the wonderful compounding pharmacy that we use, Crestview City. And they make us these rapid dissolve tabs that are sublingual. And what I love about it is, first of all, they're totally customizable, right? And you can also get all of your hormones replaced with 2 tablets. So we give you a morning tab that contains pregnenolone, DHEA, and testosterone. So you get the 2 precursors and the testosterone. And then we give you another tablet at bedtime with estriol, estradiol, and progesterone. And of course, we give that to you at bedtime because the progesterone helps you sleep. And so I like that we can do the full complement of all the hormones that you need in 2 easy sublingual tabs. And like I said, the doses of everything are fully customizable. So I'm definitely biased. So I think that's a good place to start. I will say with the testosterone, it's been my experience. So if you have never been on testosterone before, the tablets are great. And again, I'm not against creams or patches. I'm not against any of it. If you are not new to testosterone, though, I have a lot of patients that come to me with a history of pellet therapy. And if you have ever been on pellets or injectable testosterone, then I always go straight to injectable testosterone because when someone has been on like a stronger form, the tablets are just not enough. And I give people the tablets and they just say they don't feel anything, it doesn't work. And so if they have a history, like, because I get a lot of patients that previously were on pellets and they want to transition off the pellets, and then I go straight to injectable.
Yeah, very interesting.
Yeah. And what I like about the injectable over the pellets is that with the pellets, again, I'm not anti-pellet, right? Like a lot of people take them and they feel great and it's wonderful. But the thing with the pellets is you put it in and there it is. And if the dose is not quite right, there's really nothing you can do besides
Mm.
just wait it out, right? And what's nice about the injectable is that you have the bottle, you have the needles, and so you can figure out how much you need to take every week. And so if you do a dose and it turns out that it's too high, so you just do a little less next week. Like it's not like you're overdosed for months on end. Just a
Mm.
couple days, and it's out of your system. And if it's not enough, again, you can increase the dose for the following week. Like it's just a lot easier to manipulate. So I
Mm.
I like the injectable a lot.
Yeah, sure. It's easier to control.